Hi, my name is Eva Steiner, and this is my project Psychotherapists Around the Globe. I am interviewing the psychotherapists around the world and asking them the same 8 questions. I am wondering how mental health profession is in their country. Today we are going to Thank you for taking this time for doing this interview with me. Before we start, can you tell me a little bit about yourself?
Yeah, thank you for having me. So my name is Darby Carlson and I'm a registered psychotherapist, specifically out of the province of Ontario, but working in Canada through different provinces. So I work with a lot of trauma and ADHD. I've been working for a few years and I own a group practice called Fika Mental Health where I get to work with a lot of other really talented clinicians. And I just really enjoy it.
Tell me a little bit about your culture. What is some holiday or traditions that your country celebrates? And if your culture would be an emotion, what emotion would it be?
Canada as a whole is really multicultural, so it's really hard to say like one specific thing about any specific culture. Obviously, I understand that like I have my own lens that I view things through, and so my background family-wise is we're from the UK very specifically, and then Scandinavia. So like that's kind of my perception. But as a whole, Canada really looks at, I think, diversity and inclusion when it comes to culture and trying to make sure that there's acceptance for the things that bring joy to people and the way that we celebrate and the way that we view different things like mental health and social policy. So for holidays, Christmas is a big one. We do Easter, Canadian Thanksgiving, depending on, again, who you're speaking to. But then there's also individuals that I know that celebrate things like Diwali, which I think is happening right now, and then Ramadan as well. So we're very lucky in that we get exposure to so many different ways of enjoying the world. And then when you think about Canada or Canadian culture as an emotion, I think, or that feeling of compassion comes to mind, just because, again, we're known for being very polite, but I think that kindness and inclusivity encapsulates that because we are trying to take so many different perspectives and trying to include so many perspectives and then accepting them as well. And so there is a lot of compassion when it comes to being curious and open to the different ways that we see the world.
Can you tell me more about Canadian Thanksgiving?
Yeah, Canadian Thanksgiving happens, I think, about a month usually before American Thanksgiving. And when we're growing up, we're taught that Thanksgiving has to do with when the Pilgrims landed. I don't know how much I don't want to say subscribe to that, but a lot of our Indigenous population already had what was known as like a harvest meal before that was even the case. So I like to kind of view it as that opportunity to get together with your family and be grateful, but not so specifically in that westernized view, which again could just be my perception. But as a whole, that is what we're taught in schools, is that the Pilgrims came, they had this feast, but the harvest feasts were happening long before that.
And can you tell me more about the politeness?
I think that the politeness stereotype is a fair one. At one point, my husband and I lived overseas, and like it was kind of confirmed to us that we apologized way too often. We said sorry a lot, but I think there's this difference, and especially we did notice it actually when we lived in another country, where we will hold doors for each other. Everyone kind of waits for the person behind them, even if they're like 100 feet away, and it's just that awkward in between. But there is a little bit more consideration, I think, when it comes to people around us that like you don't even necessarily have to know, and just making space for everyone.
How did you become a psychotherapist in your country, and what is your therapeutic approach?
Yeah, so the process to become a psychotherapist in Canada, it does vary between provinces. So in certain provinces, it's not regulated to provide therapy. So you can do therapy without anything, which is kind of scary sometimes. But there's also really great individuals out there that provide services that maybe aren't regulated. So in my case, though, I did a 4 years honors degree in psychology. And then I actually did 2 master's degrees in psychology related things. Like I did clinical and then I did counseling, but you only need 1. So you do your 3 or 4 year degree, and then you do a 2.5-ish year master's degree, which includes a lot of like skills and theory, an in-person or like face-to-face. So it can be virtual too, clinical practicum. So in my case, I had to do a minimum of 200 client-facing hours to graduate. And then that's also with like face-to-face classes and then more assignments during that. It's kind of a graduated licensing system with the license that I have. So you finish and you are a registered psychotherapist qualifying, and then you have to continue to do more hours and then more supervision hours post-grad before you can drop that qualifying piece. And then even beyond that, there's another kind of level to that tier where you can be a registered psychotherapist, but you're still receiving supervision, just maybe like less frequently, or the obligation is less frequent, and then more client-facing hours. And then you meet independent practice. So that can actually take quite a few years, and then you're paying for supervision a lot of time out of pocket, but we're required in those like learning stages to be getting supervision like weekly, bi-weekly. So that's an hour of consult time with someone who is more qualified than we are, or has more experience than we do. And then once you are in independent practice, it's not required, but most people will still continue that just ethically and like for safe and effective use of self. So that's how I've got to this point. I also did some research in the NHS when I was working overseas, and that's what kind of made me switch gears to the counseling psychology, because I didn't want to do the more research focused degrees anymore. But the way that I approach therapy is pretty roots based. So I really like to help people understand how their childhood experiences or their relationships with their parents or their caregivers has impacted them in the now and how they understand their world. So this might look like how we believe, our belief systems around who we are, who other people are, the safety of society. And then I like to take things from a very trauma-informed lens as well. So that being said, when it's root focused, I really include people's somatic experiences and like maybe sometimes their spiritual experiences as well, because I have a hard time with frameworks that are only thought based or very present based. And I'll use things like that. So in my mind, that could be something like CBT. So I'll use it as a strategy or a tool as a part of the toolbox for someone, but it's never my main framework. So I think I like to pull from different areas, but making sure that people know we're looking at the roots so that they can learn about themselves and then not leave therapy having to come back 6 months later.
So the way I am hearing you, there is no universal law, but it's depending on the provinces.
Yeah, right now at this point. Yeah. So in Canada, our licenses are a little bit different with that regulation piece than maybe like social work or psychology. So a psychologist in every province has regulation, a social worker in every province has regulation. But right now we're working on having every province start to be regulated. Right now, the province that I live in Alberta, they're looking at like bringing that in next year. And then BC has also just announced that they're going to regulate. So they're working on it. It's just a slow, very political process.
And can I just go directly to a therapy direction? Let's say that I am a nurse or economist and I just go to psychoanalysis or any other therapy direction and call myself a therapist or work. Is that possible?
A nurse could. In a lot of places, yeah, nurses can practice psychotherapy, but not anyone could, no. So in the unregulated provinces, yeah, some people could, like if they're like someone working in finance and they decided that they wanted to do counseling, they could do that. There wouldn't be insurance coverage for it. And even in the unregulated provinces, there's still an association that tries to regulate a little bit and like gives out numbers that still require a master's degree that some insurance bodies will take. But yeah, in the unregulated provinces, anyone can provide therapy. Again, it's just like the question of safety. So like a nurse, of course, would have different training and probably be more qualified, but in those unregulated spaces, it could be anybody doing that.
And do you maybe know which other professions besides nurse are having maybe a little bit different or are more qualified or can work as mental health counselors?
So our general doctors are also allowed. There's 6 different colleges that can call themselves psychotherapists. So like social work's allowed to do that because again, they're providing a similar service or the same service depending on their training. Like I have a social worker that I work with and she does psychotherapy. I can't remember all of them. So there's psychologists, psychotherapists, social work, nursing, and then doctors. And there's one more. I think it's occupational therapists. So again, it's just a matter of like, if you're offering this service, making sure that you feel like you have the sufficient training to do the actual counseling.
So I can, for example, finish nursing school and I can become a psychotherapist without additional training. This is how I am understanding you.
Yeah, as long as it's, again, like if you've got some mental health experience, you could call yourself a nurse psychotherapist, but it doesn't necessarily mean that insurance would cover it. So there's still that kind of like gray area of, okay, like you can do psychotherapy, but you might not have that license number that they go, okay, this is covered, because it would be something like our public health system that maybe that would be where you could do counseling and there would be coverage for it. But it's a little bit different than a nurse going into private practice without the extra like RP title.
The way I'm hearing you, help is available privately and publicly for clients.
Yeah, so our public health system they do their best at providing free services. So you can go to your doctor and ask for mental health care, and they'll refer you to, like, it could be more of a shorter term facility, but you can always ask to keep going. So there might be counselors there, because counseling is something that doctors' offices might provide that's different than psychotherapy. So it's more skills-based coping strategies, kind of just helping people try to reduce stress, anxiety, depression before maybe they could access a psychotherapist. There's also psychiatrists that will see people, like I said, like a nurse or a nurse practitioner might do like that brief counseling kind of coping focused therapy. And then there's also agencies and publicly funded organizations that can do the same. So like where I'm from, there's a child's health center and there's lots of counseling there. So there's lots of play therapy. Kids and youth can go there and get access to service for free. Families can get services. So there's a lot of public health, but there's not quite enough. And so there is still private practice that you can access. So people have choice. The only issue with the public health system is that sometimes there's a wait list, and that's not viable for everyone.
How society looks upon psychotherapy or any psychological help?
It's less stigmatized than it used to be. There is still some stigma, and I find that that comes to a lot of the generational or population-based ideas of how we look at mental health. So like maybe somebody that's my parents' age might kind of still have that idea of like, oh, well, you can only access that if things are really, really bad, or like you should just deal with your problems yourself. Whereas people that are maybe like in their 20s and 30s kind of go, okay, this is just something that's in my toolbox and it's a part of my overall health picture. And again, that's not everyone, right? There's still resistance in some places, and that can be for lots of different reasons. But it isn't something that's frowned upon necessarily. Like I know that in other cultures it might be, and people are starting to access more care, which is nice.
What is your society teaching about child-parent relationship, and whether these values of society also influence how you design your interventions as a therapist?
I think in our society, and again, only speaking from maybe my own cultural lens, there's still this idea of like that parent being the parent and the child being the child. And I guess that changes as you become an adult, but there's still this role that's really important, that the parent teaches the child how to exist in the world, and the idea of assertive communication is important. And there's some ideas around gentle parenting now, but it's still focused on like safety and respect and communication between two people, and then that parent being kind of that final say in things. When I think about it in the context of therapy, I've worked with different people where one way of viewing things would be true, whereas like another client, it wouldn't even be an option. So a lot of people I work with, it's a focus of like, if there is difficulty in the relationship they have with their parent, it's a lot of education around like boundaries or maybe communication or how that makes them feel, and focusing on like empowerment. It's still very rooted in respect between the two people. It's never like okay, like if this makes you uncomfortable, just cut them off, right? That's never what people want, even though a lot of social media will kind of make it look that way. There's so many layers to trying to mend a relationship with a parent before anyone gets to that point. So it could be like working on these strategies, seeing if they land. If they don't, then that's that next step. Sometimes it's just kind of accepting that a relationship with our parent might not be the way that we hoped it would be, but we can still have a positive relationship once that acceptance is more understood. There's also some individuals that maybe I've worked with where it's never an option to express yourself with a parent, or it's never an option to go low contact or just not talk to them at all. So then we focus very much on the empowerment of like, okay, what can we control? How do we want to show up? What aspects of this are our own independent experience when we know that we have to be in this family system in this one specific way? So that kind of points back at the multiculturalism that Canada exists in, because there's not going to be one specific way that parental and child relationships are viewed, and even sometimes that whole family system. So it's really listening to what the client comes in with, what they're hoping for, and then working around, what makes them feel empowered, what makes them feel emotionally and physically safe, and what feels like it's right for them, but they are the one leading that.
And how would society feel about cutting off the parents completely?
Yeah, like I said, it's never something that people go to first. We never want that to be what happens, but I think when that is the choice that's made, it's usually after someone's worked pretty extensively on maybe trauma or, like I said, trying to form boundaries, and maybe those boundaries just being stomped on, or trying to communicate and it not being heard, or it not being met with kindness back or respect back. So it's usually like a last resort when people just recognize that that relationship isn't going to change, but maybe it's also not a safe one for them, or it affects them in really negative ways. And so it's a last resort. It's not something that's encouraged, because as independent as individualistic cultures are, we're still interdependent. No one is an island. Nobody wants to be alone or isolated. And so if that's an experience that someone's having, it's kind of that last ditch effort to mending a family relationship. People also might choose it out of a place of like, maybe there's been trauma in that relationship, but it's not, again, that first approach.
But for example, among friends, if somebody would say, I cut off my parents for whatever reason, even if the last resort, would they be acceptance? Would they be skeptical? Would they just keep quiet? How would the society react?
Yeah, I think, like, again, from my cultural perspective, it would be met with just curiosity and support. When we have these friendships, we trust that the person is making a choice that's best suited to them. So there's that autonomy piece that's really big. Unless they were like trying to explore it in another way, then it's just people make the choices that they make, and they are the ones that know what's in their best interest.
What are the learned beliefs regarding client-therapist relationship, and can the relationship continues outside the therapy once the therapy process is over?
Yeah, so the relationship, it's very much, there's a lot of rules and ethics and laws around it. So it's focused on the client. Self-disclosure or talking about yourself in any way has to be very much intentional with how this is going to help the therapeutic relationship. So the relationship itself is really important and integral in healing and the therapy, but it's one-sided in terms of it being focused on the client only. You're not allowed to be friends with your client outside of that therapy session. So we're not supposed to have anybody follow us on personal social medias. So we can't add Facebook friends. There's rules around it. I think it's 3 years actually that we have to wait if we were to be friends with someone. So once that relationship ends, then there's a 3-year waiting period where, okay, now it's maybe okay, but I still don't know if that would be something comfortable, because you've had this very intimate connection with someone where they're very, very vulnerable, and you're creating that space for them, where to shift it into friendship would probably be hard on that dynamic, right? So it's not an option, basically.
Let's say that there is a therapeutic abuse going on. So the therapist is the one that is crossing the line. Is there any institution where the client can turn to?
Yeah, so like I was mentioning, in the regulated provinces, there is a governing body, and so people can file complaints and make reports. That's something that is disciplined, and there's laws around it. So we have the Health Act law in Ontario, where my license is based out of, and therapists have to go through like a little tribunal, kind of like a little court in the college, and then people might pay fines or have their licenses taken away. So there is people who focus on protecting the patient or protecting the client.
Okay, for me it's so interesting that it's like different in every province.
I know.
They're really autonomous then?
Yeah, they are. I don't know why it's like this, because even the ones that are federally, like every province has regulation, they're still not within one for some reason. And I'm sure there's maybe just reason for that I'm not aware of. But yeah, they're all autonomous of one another. Some of them will work sort of together. So like certain provinces, if you're a psychologist, they might let you work more easily in another province out east, like depending on where maybe they don't have as many of those practitioners, but it's very standalone.
So actually, if you are qualified in one province, of course, you then need to re-qualify in the other if you move, similar to the States.
So it's not quite as, the States is very strict with that piece. It's a little bit easier in Canada. Certain provinces, if you want to regulate, or if you move and you have the same qualifications, they might just make you do like an exam. So instead of having to redo like a bunch of hours or do more hours, it's a little bit easier that way.
Okay, the 6th question. Is supervision a must for a therapist in your country?
Like I kind of talked about, it is when we're going through our program, and then it still is when we're graduated, and then it's more of something that you access because it feels like it's a safe way to practice and it's like an ethical way to practice because none of us exist in a bubble. So it's always nice to have that extra perspective or just kind of that safety of like, oh, I don't have to figure this all out by myself. So most people will continue with supervision beyond when they need to. It just becomes less frequent. So I still attend supervision, even though like college wise, I'm not obligated to, but I do think it's really important. It's once a week when you're in school, and then they try to keep it like bi-weekly just because we want clients to be safe as well as that therapist. And sometimes it's not just case consultation. Sometimes it's kind of like how are you as the therapist feeling? And it's creating space for all aspects of that experience when you're doing this role.
What are the most common complaints that a client comes to therapy for?
A lot of people will view mental health as like kind of this wider picture. So it's not necessarily that you have to be like kind of rock bottom or you have to go through something really, really horrible to access care. So some people will be like, oh, I'm noticing more stress, so I'm going to go learn some coping strategies, or I'm going to go talk to someone about it. Or it could be like life transitions, or maybe you've found out that you have ADHD and you want to learn more about that and you want to learn strategies, work on self-esteem. A lot of people will access care for present and past trauma, depression. Sometimes there's people who access care for gender identity or sexuality, and just like learning more about yourself and trying to figure out, okay, like if today I feel all of these feelings, like maybe there's better ways for me to create more like a values-based or meaningful life. So there's a ton of different reasons that people access therapy, and it's nice actually because that means that people are going, hey, like I don't have to go through whatever this experience is by myself, and I'm going to work through it with somebody who maybe can support me a bit differently, a friend or a family.
Yeah, they really access help sooner.
Yeah.
Compared to other countries or majority of other countries. Yeah. That also says something about stigma and mental health. You know, they see it as a tool instead of the last resort.
That is part of my understanding of other cultures sometimes too, is where it is like that thing where you have to be really, really, really struggling before it's viewed as something that's okay for you to do. And then there's a stigma attached to even accessing that care as well. And so I love that in Canada, it's this thing that's less stigmatized than other places. And I hope that other countries can get to that at some point.
One more question. Do you feel there is some sort of generational trauma or maybe trauma from certain group that is still influencing like mental health of people today?
I think that intergenerational trauma exists everywhere. In Canada specifically, there's a lot of localization around intergenerational trauma in Indigenous populations, and that does come with more stigma or more bias around Indigenous peoples, which is not fair and it's not okay. And so part of the mental health perspective that a lot of the politics is trying to focus on is increasing access to safe and effective and culturally competent care, which is something that sometimes we miss. And then, like I said, it being such a diverse place, there is different cultural intergenerational trauma that exists. And it's just kind of working with the client when they show up in your space and trying to be as culturally informed as you can. And if it's not something that you maybe have that skill set for, referring to someone who is able to provide culturally and trauma-informed care. But I think that there's this understanding of trauma, like this big T, or everything has to be really, really significant for it to feel like trauma, especially intergenerational. But we miss that idea that things that are intergenerational don't have to be loud and severe for them to affect us. And so when people talk about being cycle breakers, like there are little cycles that we can break. And there's even just ways of like viewing ourselves or viewing others that can be part of like a little T intergenerational trauma that people don't realize. So I think it affects across culture, but then from that more like loud way of understanding things, there are areas that get talked about more often politically, but I think it's a spectrum when it comes to how we understand that, where some of it we see all the time and we understand that as intergenerational trauma, and then people's own experiences of intergenerational trauma that maybe they don't give enough credit to.
Okay, the last question. If you would share one tool, belief, or approach that is a must-have for you as a therapist, what would that be?
So I am specialized in EMDR and I'm certified in EMDR. And one of the things that I love that comes from that is this idea of using kind of an observational self. I think there's so much benefit to people understanding that when you observe your situation, you can separate yourself a little bit from that experience of our thoughts and feelings and getting kind of stuck in maybe like a snowball. And whenever a client talks about, hey, like I noticed this, it's so powerful because it means that they're not going, oh, like this must mean it's true about me, because they haven't been able to just kind of look at it from this point of view of maybe this can just be a thought, or maybe this can just be a memory, or this thing that happened where it doesn't have to exist so strongly in my body. But it also just builds that self-awareness, right? Because if you can observe what's happening, there's more space for you to consider that why or be curious about your experience than if it's like less observed, if that makes sense.